I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Inflammation is a natural reaction to injury or infection, but when it becomes chronic, the result can be devastating. This is the People's Pharmacy with Terry and Joe Graydon.
Many of the chronic diseases that end in itis are caused by inflammation. They're often treated by suppressing the inflammation. Would it be better to find the source of the inflammation?
Functional medicine focuses on going upstream to find the cause.
Then it looks to address that cause with adaptations to sleep, diet, and other lifestyle issues, as well as medication.
Coming up on the People's Pharmacy, treating the cause, not just the symptoms, with functional medicine.
In the People's Pharmacy Health Headlines, a study in the New England Journal of Medicine this week suggests a novel way of lowering LDL cholesterol that could be permanent. The drug works by changing gene function in the liver. This study is small, involving only 35 patients. It's more a proof of concept rather than a real clinical trial. The target of this gene therapy is PCSK9, which is crucial to the body's production of LDL cholesterol. After one infusion at the highest dose, LDL cholesterol dropped by 62%. This was maintained for up to a year. Cardiologists have been trying for decades to get LDL cholesterol as low as possible with statins and more recently with drugs called PCSK9 inhibitors. This study was not designed to determine whether the therapy will reduce fatal heart attacks over the long term. That is the hope of the pharmaceutical company developing the drug, as well as cardiologists treating patients with heart disease. It will take years to demonstrate whether this therapy actually saves lives.
People with osteoarthritis of the knee may be offered surgery to alleviate their pain. Usually, the surgeon removes some of the meniscus cartilage that's been torn. A study from Finland shows, however, that people who undergo the surgery may have more pain and poorer knee function over the following decade than people who had sham surgery with no cartilage removed. The study, published in the New England Journal of Medicine, included 146 participants followed for 10 years. While meniscus tears are visible on imaging, some scientists now believe that they're not the principal cause of pain in arthritic knees. The senior investigator commented, "This study fits into a pattern seen across medicine. Widely used treatments can persist despite limited evidence and when tested rigorously may turn out to offer little benefit or even cause harm."
In 1998, the FDA approved a new kind of asthma medicine called Montelukast. The brand name was Singulair. This oral medication works by blocking the action of leukotriene, an inflammatory compound that can cause lung and airway constriction. It was initially very popular, but early reports of psychiatric side effects began to appear in the medical literature. Adolescent patients seem to be especially prone to psychological depression and thoughts of suicide. In 2008, the FDA issued a safety alert, but it took until 2020 for the agency to require a black box warning. A new study published in JAMA Network Open reveals that the black box in the prescribing information changed doctors' behavior. Starting shortly after this highlighted warning was put in place, prescriptions for Montelukast in children and adolescents began dropping. The authors conclude that boxed warnings can have meaningful impacts on prescribing practices and thus should be carefully tailored to available evidence.
Danish researchers report that high doses of vitamin D3 starting around the 6th month of pregnancy were associated with better cognitive functioning in children. This placebo-controlled trial included over 600 mother-child pairs. The pregnant women were randomly assigned to get either a standard dose of 400 IUs daily or a high dose of 2,400 IUs daily. Neuropsychological tests were administered when the children reached 10 years of age. Kids exposed in utero to the higher dose scored better on tests of verbal and visual memory. The authors note that a growing body of research indicates that vitamin D supplementation during pregnancy is associated with multiple health benefits among offspring, including improved bone density, fewer fractures, and dental health. Given the cost and timeline required for large-scale trials, the present findings, together with existing evidence, support recommendations for increasing the dose of routine antenatal vitamin D supplementation. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Grayton. Modern medicine has developed a great many helpful treatments to control symptoms, from asthma and eczema to psoriatic arthritis and inflammatory bowel disease. These are all conditions associated with inflammation, but what causes the inflammation in the first place?
Joe spoke with our guest while I was out of town on a family matter. Dr. Susan Peyrovi practices integrative and functional medicine at Stanford Center for Integrative Medicine. She is board certified in anesthesiology and hospice and palliative medicine, in addition to integrative medicine. She also has training in functional medicine and acupuncture.
Welcome to the People's Pharmacy, Dr. Susan Peyrovi.
Thank you so much for having me.
Dr. Peyrovi, you are considered an integrative and functional medicine physician. And I think there's a lot of confusion. I know our listeners keep asking, well, should I go see a functional doctor, a functional medicine physician? What is an integrative doctor? What is a functional medicine physician? How do they differ?
Well, that's a great question, and it's one that I get quite often. So there's many different words that we use to describe this area of medicine that involves the use of non-pharmaceutical therapies, for example, lifestyle therapies, herbs, supplements, complementary therapies. Sometimes they're called holistic therapies. Some people call it Eastern therapies. And integrative and functional medicine have become more established frameworks that we use now. And there's different training programs actually for integrative medicine versus functional medicine. So I'll start with describing integrative medicine. It's the study of basically trying to figure out how to balance a person's health, their bodily functions through the use of non-pharmaceutical therapies like I described, but also bringing in the pharmaceutical therapies when necessary. It's really a bridging of all the tools that we have. Whereas, pharmaceuticals do a great job at treating dysfunction, shutting down a pathway that might be acting up and leading to inflammation or various symptoms, but that's not really doing anything to improve that person's level of cellular health, what's happening at the microscopic level at the cells. And so this is where lifestyle therapies come in, where we're talking to people about eating foods that are going to be helpful at the cellular level, moving our bodies more, managing stress, prioritizing daytime rest and sleep and social connections, also avoiding toxins in the environment. So in integrative medicine, we're bringing together conventional Western medicine that uses pharmaceuticals, testing, laboratory testing, radiology, surgery, bringing that together with the non-pharmaceutical strategies to really give that person the best of both worlds. And so functional medicine takes things about 10 steps further. And functional medicine actually has a very robust and beautiful framework for understanding how the human body works through systems of function, right? So in conventional Western medicine, when we go to medical school, we pick our favorite organ, we go and specialize in it, and we become a nephrologist, a cardiologist, a hepatologist, and we're looking at the body through various organ systems. In functional medicine, we're looking at the body through systems of function, such as how does this person's body produce energy to fuel everything that needs to happen to run this person's body, from being able to think and do mental tasks, to producing hormones, to being able to move our muscles. So, for example, energy production is one such function that functional medicine focuses on. Another function would be assimilation, which is a fancy word telling us how does the human body take external things and incorporate them into the body. And the best example of this is food and nutrition. How do we take food, which is an external thing, and we break it down into pieces that can now be pulled into the body and utilized as building blocks for everything that the body needs to build and produce? And so there are many other functions that we study as functional medicine practitioners, and it helps us have language to describe things that conventional medicine might struggle with. For example, fatigue is a very common symptom that we are now seeing, especially after the pandemic, whether it's fatigue or chronic fatigue syndrome, long COVID. Having the functional medicine framework allows me to look at the person in front of me and think about how their different systems might be functioning or dysfunctioning.
Well, Dr. Peyrovi, you're getting to the heart of something I've been interested in for a really long time now. And so let's sort of divvy this up, because Western medicine has become extraordinarily good at treating symptoms, as you suggested. And I'm thinking now about all of those commercials we see on television these days for what we call IL blockers, interleukin blockers, whichever one. They're now, a dozen, 24 interleukins, and we have monoclonal antibodies, MABs, that'll treat psoriatic and rheumatoid arthritis, polymyalgia rheumatica, inflammatory bowel disease like Crohn's or ulcerative colitis, and then we have, inflammatory asthma, eosinophilic asthma. The commercials are quite prevalent on television. And let's not forget atopic dermatitis. So whenever we hear itis, we know that we're dealing with inflammation. And the pharmaceutical industry is great at blocking those interleukins that cause inflammation. But I want to know what's causing the inflammation in the first place. And is there any way to get at the root cause rather than the end result?
Well, that's a great question, and that's what functional medicine is really equipped with answering. So what you listed off were many different conditions where the immune system is overreacting, or it's actually maybe reacting to something that's a disturbance in the body, and that's its normal response. And inflammation is really foundational to many chronic modern day illnesses. So, the itis that you mentioned is pretty pervasive in everything that I get to see in my clinical practice. And so the immune system is looking constantly to the environment to try to figure out what's going on. Are things safe? Or is there danger? And if there are danger signals being detected by the immune system, then the immune system's job is to help defend and repair. And so it will put out its soldiers, a variety of cells, interleukins, cytokines, all kinds of communication molecules to help deal with the danger that has been detected. And so the immune system's functioning off of danger signals. Now, danger signals could come in many forms. They could be a viral infection. It could be trauma or an injury, like you were in a car accident. Or it could be something like not getting enough sleep. Inadequate sleep is a danger signal as recognized by the immune system. So is eating artificial foods with lots of ingredients that you can't pronounce, that your body was never supposed to come in contact with. And so when weird foreign things enter the body, the immune system reacts and starts putting out its cells and soldiers and creating inflammation.
Well, it seems like we're kind of doing it backwards in the sense that if something is triggering an immune reaction, pharmaceuticals are very good at blocking that final reaction. But why shouldn't we prevent that precipitating event in the first place?
Well, what you're talking about is upstream versus downstream medicine.
Exactly.
Right? So in conventional Western medicine, our tools are pharmaceuticals, and that's an important approach. We are not against pharmaceuticals. Pharmaceuticals are very targeted, they're very specific, they're very powerful, and they may go in and shut down a pathway or block a certain kind of cell to get the immune system to calm down. And that is an approach that we benefit from when we have some of these very complicated immune issues that can be very uncomfortable. But that's not the whole story. And this is where integrative and functional medicine step in and say, look, there's so much more we can do for this person's immune system. What this person is probably experiencing is a dysregulated immune system, where the immune system has forgotten the rules. It's forgotten what to attack and what to leave alone. And so it might be attacking the wrong thing, and that could either be an autoimmune disease, it could be a food allergy or a food reaction. So what we want to do is to get the immune system to follow the rules better, to become more regulated. And so we can put into place different signals, something different than danger signals, so that we can start sending signals to the immune system that it's okay to calm down. You don't have to keep making inflammation. There's safety. So how do we do that? Well, it always, for me, goes down back to the lifestyle habits.
I'm going to ask you to hold right there, if you don't mind, Dr. Peyrovi, because we're coming up on a break. And when we come back, we're going to find out what we can do to calm the immune system.
You're listening to Dr. Susan Peyrovi. She practices integrative and functional medicine at Stanford Center for Integrative Medicine. Dr. Peyrovi is board certified in anesthesiology and hospice and palliative medicine in addition to integrative medicine.
After the break, we'll find out more about how functional medicine addresses health problems.
Can we have better success going upstream rather than treating each symptom we find downstream?
If you need to calm inflammation, like all those itis problems, could you be considering natural approaches like herbs?
Dr. Peyrovi will share her personal experience with a very difficult diagnosis.
Can we unite conventional medicine and functional medicine to help patients with significant lifestyle changes?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is sponsored by Talkspace. May is Mental Health Awareness Month, and Talkspace, the leading virtual therapy provider, is sharing the message that connection is crucial because good relationships are an essential and sometimes overlooked component of mental well-being. If your relationships could use some strengthening, a licensed therapist from Talkspace can help. Therapy can help you communicate better with loved ones, repair conflicts, and understand how to address loneliness and build community. It's easy to sign up. Just go to Talkspace.com and you'll be paired with a therapist within 2 days. You'll meet with your therapist online on your schedule. Plus, Talkspace is in-network with most major insurers, and most insured members have a $0 copay. Make personal connections a priority and start today. If you're not covered by insurance, get $80 off your first month with Talkspace when you go to Talkspace.com and enter promo code SPACE80. That's SPACE80. To match with a licensed therapist today, go to Talkspace.com and enter promo code SPACE80.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. We're talking about functional medicine today and how it differs from the conventional approach to treating symptoms. Another way to think about this approach is to call it upstream medicine. It seeks the causes of things like inflammation rather than just focusing on alleviating symptoms. Could root causes be addressed with lifestyle changes?
To help us better understand this approach, we are talking with Dr. Susan Peyrovi. She practices integrative and functional medicine at Stanford Center for Integrative Medicine. Dr. Peyrovi is board certified in anesthesiology and hospice and palliative medicine, as well as integrative medicine. She also has training in functional medicine and acupuncture.
Before I interrupted you, Dr. Peyrovi, you were about to tell us about how we can calm things down upstream rather than downstream.
Sure. So if we're trying to send different signals to the immune system so that it gets the message that it's okay to stop making inflammation, then we can start with things that have to do with our routines and behaviors, those simple, small decisions we make throughout the day, such as getting a little more sleep. If there are people getting 5 hours of sleep, I don't want them to panic. You don't have to get 8 to 9 hours to start making, changes in the right direction. I tell my patients, just go in small incremental steps, get an extra 30 minutes, get an extra hour of sleep. That is going to send a signal of safety to your immune system because the immune system and the sleep system are always talking to each other, right? And one way we can calm the immune system down is to sleep more. We can move our bodies more. We can eat healing foods that are actually anti-inflammatory in nature. They actually will send information to the immune system to calm down. And these would be foods that are mostly plants, lots and lots of color so that we're getting those phytonutrient molecules. I tell my patients, eat the rainbow at least once or twice a day, each color. Stress is a big one. Stress is a major, major danger signal for the immune system. So if we can get rid of stressors that are possible to get rid of, I'd start there. But, for whatever stress is left over, just finding ways to build more resilience towards stress so that we don't react so much. This can allow our immune system and nervous system to both calm down. So building stress resilience is really impactful for getting the immune system to calm down.
Well, I keep thinking about Mother Nature having provided us with lots of natural approaches that have anti-inflammatory activity. We frequently talk to another functional medicine physician, Dr. Tirone Lodog, who is also an herbalist, and she has provided us literally dozens of herbal approaches and spices that can help the immune system calm down without using powerful corticosteroids, which also calm the immune system, but it's sort of like a blunderbuss rather than a pea shooter. Before we go any further, though, Dr. Peyrovi, I would really like you to tell us your personal story about how you got interested in functional medicine, your own health issues.
Sure. I started out as an anesthesiologist, and I loved that work in the operating room of doing heroic things along with our surgical colleagues. And I loved it. I worked in my last job, 100 hours a week. I wasn't sleeping. I wasn't eating anything other than hospital food. My only exercise was, my heart rate going up when I was doing a trauma case. And eventually my own immune system, I think, said no more. And I ended up getting diagnosed with multiple sclerosis shortly after the birth of my first child. And interestingly, my main symptom associated with this autoimmune disease of the nervous system was left arm and hand weakness, which happens to be probably the one body part you need to safely practice anesthesia because a lot of the instruments are left-handed. Couldn't practice safely anymore, had to pivot, and I landed at an integrative medicine conference as I was trying to figure out, well, what kind of doctor can I be if I can't practice anesthesia anymore? And within an hour of being at this conference in San Diego, what I thought was, I've found my people. Here are other practitioners who have had their own health issues and challenges, and here they are learning new ways of treating their patients. And that was the beginning of it. I studied integrative medicine. In fact, Dr. Lodog was one of my teachers. And then, one thing leads to another as you hang out in these circles. And I became interested in functional medicine. And, and that was a 2-year program, and got to learn all of that robust biochemistry and to really dig into all of those magnificent reactions that are happening under the surface without us even having to think about it. I mean, if you think about the human body, it is really a remarkable machine. And I just loved learning everything that there was to learn about how we can tap into the beautiful machinery to make it work for us. And so much of my motivation in learning integrative and functional medicine was how to actually improve my own health. But as a side effect, it ended up being, the next thing that I started working at, in my clinical practice at Stanford.
Thank you so much for sharing that. I think that one of the challenges that we are faced with in our society and in the world in general is the polarization of just about everything. And what we see is that modern medicine, evidence-based medicine, randomized controlled trials, that is perceived as the ultimate. That is the summit of the mountain. And this thing called integrative medicine or functional medicine in a lot of places, a lot of medical schools, is kind of in the back seat, if not in the rear view mirror. It's like fruits and nuts, hocus pocus. You can't trust it. There's no science there. What we need are randomized control trials with pharmaceuticals. And we do love pharmaceuticals. They've done marvelous things. What would we be without our antibiotics? But how do we begin to unite these two polar opposites that are still somewhat fighting with each other and make room for both functional and integrative medicine along with evidence-based medicine?
That's a really good question. It's something I come across quite a bit as I am talking to my colleagues. It doesn't have to be this medicine or that medicine. No tool is equipped at addressing every single health issue. Conventional medicine, pharmaceutical medicine is great at dealing with acute conditions. We used to do heroic, amazing things in the operating room with trauma patients. No amount of herbs or food is going to help that patient, right? That is not lifestyle medicine is not the right tool for a trauma patient. But when it comes to chronic diseases, pharmaceuticals treat symptoms. They work at the downstream area where the disease process has unfolded. Yeah, now you have symptoms, and we take your history and then match that, set of information with a pharmaceutical. So we are matching a symptom with a pharmaceutical. And that's an approach that can give people relief, but it's doing nothing to start unwinding or unfolding that disease process so that maybe there isn't so much inertia behind it driving it forward. And so this is where upstream medicine, whether you want to call it holistic medicine, Eastern medicine, integrative, functional, whatever you want to call it, these forms of medicine are taking a different approach, looking at what are the imbalances. Where's the dysfunction? What can we do to bring more support into this person's body? And sometimes it's food and sometimes it's herbs, but sometimes it's tending to their mental, emotional, and spiritual dimensions, which oftentimes are at the heart of a lot of our adult chronic conditions, whether it's, ME/CFS, autoimmune diseases, psychiatric diseases. And so what I want people to take away from this is that all of these different forms of medicine are beautiful and have their own areas where they shine, but you want to pick the right tool for the right problem. And sometimes that's pharmaceuticals, and sometimes it's something non-pharmaceutical, and sometimes it's both. In fact, most often it's both. And I want all of my patients to do as well as they can, which means giving them all of the tools that are necessary. So this is where integrative medicine starts bridging the gap. And I hope that in the next decade, we actually start teaching this in medical schools, because you know who's driving it? It's patients. Because we have access to all kinds of information, patients are coming into doctors' offices and asking really hard, complex questions. And a lot of that has to do with lifestyle management. And a lot of us doctors are not equipped with answering those questions. I certainly wasn't until I went and put years and years into studying it. So I want to see lifestyle medicine enter the realm of medical education, because it's an important tool that's missing. And in my own health journey, it was by far the most impactful tool that helped me get my immune system under control.
Well, I know our listeners are wondering, how are you doing? Because multiple sclerosis is a devastating diagnosis.
You know, there's so much variability in how people experience multiple sclerosis. I happen to be very lucky. My symptoms have been very minimal. And to put things in perspective, even though I consider my symptoms to be mild, it ended my career in anesthesiologist, something I did a 4-year residency for. So the social and occupational impact was huge. But today I, enjoy very good health. I stick to my lifestyle habits the best I can. I always tell my patients, I'm not perfect. I'm just 90% perfect. I do the best that I can, because I know exercise regulates my immune system. I know eating certain foods helps, and other foods make me feel bad. So learning to tune into our bodies, which is part of something we teach patients in integrative and functional medicine, is a really helpful tool to gauge what's working and what isn't working, and not always relying on labs and tests or trackers to tell us what's happening inside our bodies.
You know what always fascinates me is that modern medicine is very good at creating silos. We have a lot of specialists. We have the dermatologists, the cardiologists, the gastroenterologists, and they don't always talk with one another, and yet they all say lifestyle is important. Eat a well-balanced diet. Exercise more. Don't smoke. Get a good night's sleep. Social contact is great. But they don't know how to help their patients implement all of those important lifestyle changes. We have talked recently with a number of exercise fanatics, I'll call them. They love exercise. Dr. Claudio Battaglini is at the University of North Carolina. He works with cancer patients, and he actually has set up programs so that cancer patients, especially breast cancer patients, can exercise together and they can work at their own speed. And it's a wonderfully supportive environment. And yet most insurance companies, while they're willing to pay for cardiac rehab, they're not really excited about the idea of cancer rehab. And that's true for a lot of other areas as well. So how do we help the medical profession, your colleagues, really make exercise a part of the program?
So unfortunately, our current medical system makes it very hard. Our doctors and specialists have limited time. They have to address the medical management, and counseling for exercise, stress management, nutrition takes time. It's not something you can do in 3 minutes and expect that it's going to turn out right for that patient. I see patients in groups. I do shared medical visits, and I will do 12-week programs, but I tell my patients 12 weeks is not even enough, to really build habits. There's repetition. There's a lot of time for counseling and brainstorming around barriers and figuring out how this person might take advice of, go exercise more and turn it into something that's actually doable for them. You cannot just give the same advice to people and expect them to all just go do it. It has to be personalized. You have to partner with the patient and kind of help them find their way and make sure that there's enough touch points where there's accountability. They can come back and tell you, how it's going. So I think it's in our current model, it's unrealistic to expect our, conventional colleagues to do that work. I'm hoping that as we change medical education, that becomes a bigger part of the conversation. But I do know of practices that use, nurse practitioners, health coaches to do a lot of that counseling, which unfortunately, a lot of it is hard to get reimbursed under insurance. But I think that's changing as well.
I wonder if you have a quick success story you can share with one of your patients or somebody you have worked with that's been able to make those changes and seen a big difference. I know it's worked for you, but how about one of your patients?
Sure. I work quite a bit with chronic fatigue syndrome patients, and I can tell you these are some of the hardest patients to treat because their ability to engage is very limited due to lack of energy. And so I can think of one person that I worked with over the course of at least a year. I mean, we've probably known each other much longer than that. But it was like peeling the onion very slowly, layer by layer, trying to just figure out what's the next right thing to do, not the next 15 steps, but what's the next step that we need to focus on. And some days it was around this concept of pacing, where we kind of figure out how we're going to budget our energy. How will we use our energy? What things are we just not going to do that day? And, it takes time to learn how to pace and to budget energy better. And, somewhere over a course of 6 months or more, I think this person, using some tools, was able to better understand how their energy responded to certain things and what they could actually do to get more energy.
Well, we're going to take a break right there. When we come back, we'll talk a little bit more about that patient and how to pace yourself, and we'll talk about pain.
You're listening to Dr. Susan Peyrovi. She practices integrative and functional medicine at Stanford's Center for Integrative Medicine. Dr. Peyrovi is board certified in anesthesiology and hospice and palliative medicine, as well as integrative medicine. She also has additional training in functional medicine and acupuncture.
Terry, I really love the idea that patients are driving this process to what we are calling integrative or functional medicine. They're saying, I demand this, and if insurance won't pay, I'll cover it until insurance will pay. Well, after the break, we're going to hear more about a patient with chronic fatigue syndrome.
As an anesthesiologist, Dr. Peyrovi had many approaches to helping ease patients' pain.
Gabapentin is the most prescribed drug for pain in the U.S. People vary quite a bit in their reactions to it, and other pain medicines like Tramadol. What works for one person can be either ineffective or devastating for someone else.
We'll also learn about palliative care and how that differs from other treatment situations.
Is there a way to bridge this chasm between conventional medicine and functional medicine approaches?
You're listening to The People's Pharmacy with Joe and Terry Graydon. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids this allergy season. More at getsonu.com. That's getsonu.com.
And by Spatial Sleep, a non-drug approach to help you fall asleep and stay asleep without medications. More information at spatialsleep.com.
Today on The People's Pharmacy, we're exploring the idea of functional medicine and how addressing root causes may help ease inflammation. Could lifestyle medicine help calm an overactive immune system?
Our guest is Dr. Susan Peyrovi, who practices integrative and functional medicine at Stanford Center for Integrative Medicine. Dr. Peyrovi is board certified in anesthesiology and hospice and palliative medicine, as well as integrative medicine. She also has training in functional medicine and acupuncture. At the end of our last segment, Dr. Peyrovi was describing her work with a patient who has chronic fatigue syndrome.
Dr. Peyrovi, before I so rudely interrupted you, you were talking about a patient who had chronic fatigue syndrome and was learning how to pace themselves so that they could get things done in a way that wasn't so challenging.
Yeah, and that's part of the treatment. But for this person, what ended up being really transformative was tending to their psycho-emotional health. A lot of past stress, past trauma, and finding the right people to find resources to address that over time ended up probably being the most impactful tool in getting this person to make progress.
Dr. Peyrovi, I'd like to go back to your previous life as an anesthesiologist, and I'd also like to talk about your work in hospice and palliative medicine. My mentor, when I was at the University of Michigan in grad school in pharmacology, was Dr. Ed Domino. And Dr. Domino was the first researcher to explore ketamine as a anesthetic agent, and he described it as a dissociative anesthetic. These days, ketamine is very controversial because people are using it to treat depression, and they're using it for pain. Your thoughts about ketamine?
Well, it's been a while since I've pushed ketamine, but again, it's another tool, and for the right patient, I think it can be really helpful. It just works on a different set of receptors, works on a different system. So, this idea that either things are good or bad doesn't make sense to me. The question is, what's the right tool? And ketamine can be really helpful in treatment of pain and depression. I mean, I've used when I used to work in the ICU, used ketamine drips in terminal end of life patients and gave them great, lots of relief. But it doesn't work for everybody. There are people who try ketamine for depression, for example, or for pain, and it doesn't work because we're all genetically different. We respond differently. But again, it's another tool in the toolkit.
Well, I really appreciate the fact that you pointed out that nothing works for everybody, and some people get benefit and some people don't. The number one most prescribed pain medicine in America these days is gabapentin. And wow, what a controversial drug, because there are so many people who tell us that drug worked really well to control my pain. And then other people say, gabapentin, what a waste of time. It didn't control my pain, and it made me foggy, and it really made me difficult to get along with my family. I got so depressed and even suicidal. And so the idea that gabapentin is either good or bad is ridiculous. For some people, it's great, and for some people, it's terrible.
Exactly. I mean, I think you can say that just about any drug. Low-dose naltrexone is one that is being tried now for a lot of patients with autoimmunity, long COVID. And there are patients who say it was transformative. And then there are patients who say it did nothing for me or they had side effects. So again, it just goes to this idea that we can't have this black and white thinking. We want to try different things and pivot when needed.
There is a pain specialist at Stanford, Dr. Sean Mackey, who we have interviewed on a number of occasions, and he points out that pain is personal, that everybody's different. And that's where it seems to me that functional medicine plays a critical role, because it really has to pay attention to the patient. That's why there's no one medicine that's going to be perfect or one medicine that's going to be terrible.
I think this is where functional medicine shines. Like you said, we take a different approach rather than just looking at the physical. We try to go deeper and look at this person's history. We often, when we first meet a patient, we create a timeline of their life, plotting out life events against health events. And then you sit back, zoom out, and see what patterns might arise. And I actually do this work with my patients. They do this for themselves. And oftentimes what they'll say is like, I can see every time there was increased stress within, months, a week, a year, I maybe got a new diagnosis or an exacerbation of my symptoms. So taking into consideration all the different dimensions of a person, whether it's the mental, the emotional, the spiritual, all of that matters because we are not just physical beings. And, it takes time to do that intake. You cannot get that done, in a 45-minute visit. And so I hope that we can find ways to bring this type of practice into the mainstream because it's a disservice when we ignore all of the other facets that can be contributing to somebody's pain. Pain isn't always just a physical imbalance, right? A lot of times it has to do with past trauma or current stress. So if you want to make good progress, you got to take the whole person into consideration.
Dr. Peyrovi, I'd like to segue to an area that most people don't like to think about or talk about. And that has to do with hospice care and palliative medicine. People like to think they're going to live forever, even though they know that they won't. When you specialize in palliative medicine, what does that mean? And how do you care for individuals at that stage of their life when they know they're not going to have a lot longer to live?
I got interested in hospice and palliative medicine as a medical student. I got the opportunity to do rounds with a hospice nurse and go see patients with her. And what really jumped out at me was like, who are these practitioners that can hold space for these patients that are end of life, suffering perhaps quite a bit, and being able to come in, use their skills to make sure this person is comfortable and has a transition that's, good for them, for their families. And so after I had to quit anesthesia, the next thing I actually did was training in hospice and palliative care. And it felt very important for me to be able to bring comfort and care to patients in their homes, to honor their wishes, to be with family in those last, weeks, days, hours, and keeping them out of the hospital, not medicalizing the dying process, but instead just letting it unfold naturally as nature intended. It's really a beautiful thing when someone can have a good death and you've been a part of that process, making sure that they had the medications and the support to make that happen.
I'm wondering how you interact with your, we'll call them more traditional medical colleagues who think that, oh my goodness, we have to rush that patient to the hospital. They're having problems breathing, or their kidneys aren't working. We have to get them on dialysis. And that may be not something the patient or the family really wants, but somehow they get sucked into that vortex and they end up in the hospital, even if it's a very dire situation.
Yeah. In fact, I'm actually experiencing this with a very close family member right now. People who go into medicine are doers. We become doctors because we want to do things to help alleviate suffering and to treat people. But it's equally important to stop and think, is this a time where I just need to step back and take a different approach? And this is where listening to your patient becomes so important, and why families should have discussions about what somebody would want at the end of life well before it even becomes an issue, right? So that when the time comes, things can be more orderly. We can just kind of go through the steps that need to be taken to make sure that this person gets what they need. And I think we're getting better at honoring patients' wishes. We're being proactive about getting paperwork in the chart so that we know what to do should things, change and we need to make quick decisions.
If we were able to put you in charge of medical education in America and begin the steps of bringing what we'll call evidence-based medicine or traditional medicine or conventional medicine more in line with integrative and functional medicine, what would you tell those medical students or your medical colleagues about how that chasm that currently exists could be bridged?
Well, I would love to be in charge of medical education for the country, because if we can get to our doctors early, we have a giant opportunity to change the future trajectory of human health. Pharmaceuticals are important, but so is using the body's own mechanisms to bring balance. And if we could teach lifestyle medicine early on, along with the evidence, don't mistake that because it's a different kind of medicine that's not, utilizing expensive technologies, that it's not powerful medicine. It is powerful medicine. And there is a lot of data. And on top of that, there's a lot of observation. People who work in the area of non-pharmaceutical medicine spend many years, observing and trying different things. And we learn from the observation of people like Dr. Lodog. And so if we can marry the two together early in medical education, I think we have a really good shot at getting our doctors to actually utilize lifestyle medicine as first-line medicine.
We recently received a message from a listener who said, I would really like to find a functional medicine doctor, but how? There's nobody in my small town who calls themselves a functional or integrative doctor. Everybody is sort of in some kind of a medical practice, and they're pretty traditional, and they like to prescribe medicines. Where would I turn? Where can I go? How could I find somebody more like Dr. Peyrovi?
That's a great question. So there is the Institute for Functional Medicine, ifm.org. If you go to their website, there's a button that says Find a Practitioner, and you can put in filters for where you live or what types of medical issues you're trying to address, and that will help narrow it down. You can also go to aihm.org, which is, integrative medicine. And again, on their website, they also have a button where you can find practitioners. Now, with telemedicine and Zoom, you might be able to see somebody, far away from your, local community, depending on the practitioner's licensure. And just keep in mind, not all functional medicine practitioners are physicians, MDs or DOs. There are nutritionists, acupuncturists, naturopathic doctors that are also trained in functional medicine. So it goes far beyond just treating our, conventional doctors. And so, some people really benefit by finding a functional medicine trained nutritionist who thinks differently.
So what you're saying is that if you don't have a functional medicine integrative physician in your community, you might be able to find somebody online who could walk you through the process.
Absolutely. Absolutely.
So, Dr. Peyrovi, as you look into your crystal ball, what do you see for the future of functional medicine, integrative medicine? Do you think, quote unquote, conventional medicine will someday be more open?
Absolutely. I think I've already actually started seeing the shift. I have a lot of colleagues that refer patients to my practice. Patients are asking for it, and it is becoming a bigger part of people's care plans. And I would just like to see greater insurance coverage. There are ways to make functional medicine more accessible. Many practices currently are cash-based, and so it becomes, not affordable. But shared medical appointments where a group of patients come together to discuss a topic and figure out how to put it into practice are really powerful. And for me, it's been transformative in how I've practiced functional medicine, because I get to see my patients every week now under insurance coverage. And it's just really a wonderful tool for increasing access.
Thank you so much for sharing your story and your healing process. And thank you for sharing your thoughts today on the People's Pharmacy, Dr. Susan Peyrovi.
Thank you so much. It was my pleasure to be here.
You've been listening to Dr. Susan Peyrovi, who practices integrative and functional medicine at Stanford Center for Integrative Medicine. Dr. Peyrovi is board certified in anesthesiology and hospice and palliative medicine, as well as integrative medicine. She also has training in functional medicine and acupuncture.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Today's show is number 1474. You can find it online at peoplespharmacy.com. That's where you can share your comments about this episode. You can also reach us through email, radio@peoplespharmacy.com. You'll find links in the show notes to the organizations that can refer you to functional medicine practitioners.
Have you had to deal with chronic inflammation? Did you rely on nonsteroidal anti-inflammatory drugs like ibuprofen or naproxen? Or did something else help you calm the discomfort? How did you find the right approach for your health problem?
We'd love to hear from you. Sometimes a more natural approach, such as turmeric or boswellia, can be helpful without causing the complications of corticosteroids or NSAIDs.
Our interviews are available through your favorite podcast provider. You'll find the podcast on our website on Monday morning.
At peoplespharmacy.com, you could sign up for our free online newsletter to get the latest news about important health stories. When you subscribe, you also have regular access to information about our weekly podcast. If you've always wondered what we look like, or if you've wanted to watch our guests as well as listen to them, we've started posting our video podcasts on YouTube. You can watch Dr. Tom Buckheit talk about alleviating pain in joints and nerves with regenerative medicine.
Dr. Ed Breitschwert warned us all about flea and tick bites and the diseases they can transmit. Most people have heard of Lyme disease and Rocky Mountain spotted fever, but there are several other serious diseases that can come from a bite. Watch Dr. Breitschwert describe his own experience with Rocky Mountain spotted fever and listen to a story about a young man with Bartonellosis.
If you enjoy the People's Pharmacy podcast, we'd be grateful if you'd write a review of the People's Pharmacy and post it to the podcast platform you prefer. If you find our topics thought-provoking, please share them with friends and family. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.